Hi, how are you? It is Randy of Cornmore Health and Fitness, and I wanted to take a quick minute to talk to you about cholesterol, about having your blood lipids measured every year. So many people go to the doctor and they get their numbers and they hear, uh-oh, my cholesterol's too high, and they want to put you on a statin. That might not always be the best answer immediately. There's more questions you want to ask. For one thing, you want to find out and ask them to also run what's called your CRP, your C reactive protein, along with your homocysteine. And even more importantly than that cholesterol number is understanding and knowing what your particle size is, the particle size of your LDL, the LDL, which is often referred to as your bad cholesterol. In dozens of studies, it's been shown that high cholesterol has not been the major mitigating factor in strokes and heart attacks. It's much more indicative of, as we talked about a second ago, CRP, homocysteine, and the particle size. The particle size difference is small, it's tiny, it's nanoparticles. But understand it like this. If your particles are on the bigger side and they're light and fluffy, as they're going through your arteries, you have much less chance of having a blockage because they're light, they're porous, they're like a Nerf ball, you could think of it. And chances of them getting stuck are much smaller than if your particle sizes are what they call small, dense particles of LDL. Think of that as far as an analogy as marbles going through your arteries. And marbles, small, dense marbles, can pool up and get stuck and cause a blockage. It could be your carotid artery, it could be your arteries, it could be by your heart, by your brain. You really want light, dense, fluffy, big particle sizes. It can be measured down to the size, letting you know if you're in danger or not in danger and at risk. And if you do have high cholesterol, don't run so quickly and take medication. Really discuss all of your options with your doctor, get a second opinion, and maybe just try some lifestyle changes. That could be it. That could be all you need. I could give you 5 people on the top of my head, that with diet and lifestyle, I've seen cholesterol numbers go from 260 to 170. I've seen somebody who lived with 285, 290 for 20 years and losing some weight, taking gluten out of the diet and making other small changes, is now walking around with 220. And it's a healthy 220. Just because you're 220 doesn't mean that it's too high. Those numbers have gone lower, and that's being driven by the drug companies, not because all of a sudden cholesterol needs to be 200 or 180 or 170. That didn't all change. There's so much more to it. And we've gotten so much more sophisticated in what we can test and tell as far as risk for disease, especially stroke and heart disease. And again, you can test it. And there are things you can do for it. So tune in. I'm going to give you a couple of really great supplements that you may want to take. Or again, you can speak with a doctor about it if you feel more comfortable, or a pharmacist, or not even a pharmacist, but go to Whole Foods and speak to the people in the supplement aisle. It's there for a reason. It's there because it doesn't hurt you. It's safe, and there's alternatives that aren't patented by medicine. But again, this is about you. This is about having the most information that you need to stay healthy and stay safe. So thanks for tuning in. I will see you soon. Good night.